Welcome to the People Teaching People podcast. Joining me on the podcast is Karen Lane. Karen is a registered nurse and clinical nurse instructor with nearly 20 years of experience as a healthcare provider and many years of lived experience as a patient. She has worked almost exclusively in the area of mental health and addictions, where she has provided care to diverse populations of individuals and families and worked within a range of multidisciplinary teams. Karen holds a Bachelor of Nursing and Master of Nursing from the University of Calgary, where she studied the impact on family systems of a mental health diagnosis. More recently, Karen has been teaching as a clinical instructor with Athabasca University in their nursing program within the Faculty of Health Disciplines. In her teaching, she is focused on relational practice in an online environment and providing trauma-informed education. She volunteers as a mentor with the University of Calgary's Nurse Mentor Program and also is a member of the Nursing Advisory Committee for Woods Homes. She is a wife, mother of a 6-year-old daughter, and white settler with the privilege of growing up and residing on Treaty 7 territory. In our conversation, Karen and I talk about mentorship, relational practice, the importance of community and connection, and her incredible journey in nursing that started through her experiences as a patient. Karen is one of the most incredible people that I know, and I can't wait for you to learn more about her. Thank you so much for joining me today, Karen.
Hi, Tiana. Thank you so much for having me. I'm very excited to be here.
Well, I'm excited about this conversation. I have way too many questions to ask you, and I wanted to start off by learning more about you and your story and just hearing some of the, most significant, important experiences from your journey that kind of took you on this path that you're on in nursing.
Sure. So I spent quite a bit of time in the hospital when I was a child, and so I was actually exposed to the medical system at a pretty young age, and I interacted with so many different medical professionals, all of whom were just incredible. The nurses spent the most time with me just due to the nature of their role, right? And they had a profound impact on me. I would say, they provided care with such compassion, competence, empathy, and even humor to just do what needed to be done, right? And so in nursing, we talk a lot about the art and the science of nursing, which I think is maybe not too much unlike teaching, where there's the what you're teaching and then there's the pedagogy of how you teach it, right? So for me, it was experiencing the how they delivered this care during what could have been a very traumatic time in my life, right? And growing up in the hospital a lot, it's very disruptive, or could be, and scary. But they all seem to find a way to really provide care and get through the procedures and operations with such just care and kindness. So it it affected me very deeply, and I set my sights on becoming a nurse. And I actually rarely wavered from that. And typically kids choose a different profession every week that they want to be, like my daughter does. But for me, it was nurse, always nurse. And I think one of the things that helped is that every time I'd be discharged from the hospital, the nurses would send me home with a few supplies, to play with, because they recognized that I had an interest in medicine. And so my interest didn't stop when I left hospital. It extended home, where I'd get, a syringe without a needle and some bandages and some stuff to play with. And my parents were always very willing participants to play the patients, fortunately. But so I just carried on this interest, and probably it was a way of processing what was going on too by playing it through. But even till I was a bit older, I really enjoyed just playing out the role of a nurse and kind of what that was like. So it it was hugely influential for many years of my young life. Yeah.
And is there sort of a specific time, do you think that that seed was kind of planted? Like, do you remember that moment, or is there a story with one nurse in particular, or one experience that you had that really got you thinking, this is what I want to do?
Oh, well, yeah, that's a good question, because a lot of things happened when I was just born and very young, so I didn't remember a lot of that. But I do remember when I was older, so I was probably sometime in early elementary it would have been, and there was one nurse whose name was also Karen, actually, and then there was a little girl, another patient beside me in the double room, and this nurse Karen took care of both of us, and she was just had this sparkle to her. There was something special about her, and I remember that she caught wind of the fact that one of my favorite movies was this Muppet movie. It was like the specific one that was hard to find. She ended up having it at her house, like the VHS tape, it was that
Nice.
long ago. And she brought it in and she let us watch it. And just, she did the extra little bit, right? The thing that she didn't have to do. And she let us move the hospital beds around so that me and the other little girl could play nurse and doctor and, with our teddies or whatever. So she just made it fun when it really wasn't. But it she facilitated that for us. So I remember Karen, and I tried to look her up years later, and she might have moved on or retired, but I always think of her. Yeah.
That's a beautiful story. And it really is so impactful when people do, maybe in their minds, what seems like a small thing, but
Yeah.
it really ends up being a big thing and something that we remember and appreciate and
Yeah.
think about for years to come.
So
Now,
much. Yeah.
yeah. And so, I mean, having had this experience and perspective as a patient yourself,
Mm.
how has that influenced how you approach working in the field of nursing?
Yeah, probably in more ways than I recognize. But I think what I've become aware of is, I knew what it was like to be vulnerable and to need help, right? So some of my surgeries were into my teen years when I didn't want help. I wanted to do it myself. But to accept that, and even when I'm younger, you're trying to exert your independence and, grow. And so I understood that when you're unwell, you need help, right? And support. So I think that was one thing is I can really empathize quite well with people who are struggling with their health in some way. I can appreciate how it affects so many domains of life, right? The other thing I think I recognize now that I've been practicing in nursing for quite a while is that I felt what it was to have my needs met,
Mm.
right, in terms of my health. And I now understand the very many things that impact our ability to be well and to recover and to maintain our wellness and well-being. So I've had immense privileges in my life, right, that allowed me to come through what I did quite well in a positive light. But I had access to one of the best children's hospitals in Canada. I had support and loving parents and kind friends and accommodating teachers. But I know that's not true for a lot or most people, right? So I think as a nurse, I recognize that and I kind of look for where are those disparities? Where are those gaps for these people that don't have access or don't have those privileges of an environment, of a situation, of people in their life that for which they can heal and recover in. So I think I really look at it through that lens now, right? I had the privileges and others don't.
Hmm.
Yeah. Yeah.
Yeah, and it's interesting too because I think so much too in the world of teaching, and I'm sure in the world of nursing, maybe not everybody takes the time to kind of get to know the wider picture of who a person is and
Yes.
and all those pieces that affect their overall
Yeah.
well-being. And you don't know if that kiddo sitting in your classroom or the kiddo that you're seeing in the hospital, like what's going on for them, like where are they
Mm.
really, how are they really feeling that day beyond the physical piece, and who, as you said, are the people in their corner, like what are the supports that they have outside of the supports
Yeah.
there in the hospital. There's so much more to a person's story, and so the
Yeah.
fact that you recognize that and experienced all those
Mm.
additional pieces and all the positivity that can come when they're being seen and recognized in the
Yes.
care that you're
Yeah.
being given, and how you can really carry that forward in the work that you do.
Yeah, I think there is so many parallels to teaching. You're right. Like in terms of, I know you say there's always more to the story, and you're absolutely right. I think it's so easy to judge what we see at first glance, and I work in mental health, and in mental health, there's a lot of biases and stigmas that show up, within people. If someone, let's say, has trouble getting to appointments, right? You say, why isn't that person showing up for appointments? Or why are they missing appointments? Or why is that kid missing school? Or why are they not in class? What's wrong with this person? And instead, being curious about that and thinking like, well, maybe they had to take 2 buses to get to this appointment. My patients often do. Or they'd never ride, or they didn't have the bus money, right? Like there's just more to the story. Yeah, I agree.
Yeah, more to the story. And I love how you said that, really the importance of being curious rather than
Yeah,
just making an assumption about somebody and why they've done or not done something. Yeah,
much.
getting curious and wanting to know and understand is so important.
It is.
Now, nursing like teaching, we've talked a little bit about some of the overarching similarities. There's many different as well options and pathways that you can take in your career. And I'm curious, what prompted your shift from clinical nursing into more teaching and mentoring?
Yeah, good question. So I suppose I've always enjoyed the educator aspects of the nursing role. So, if someone's diagnosed with a new illness or they're learning to manage their health, it may be educating on that or on medications or whatever. I liked that. I was sort of drawn to it. And then 10, 15 years ago, I had an opportunity to dip my toe in, I should say, to clinical nursing or clinical teaching rather through Mount Royal College. It was Mount Royal College then. That's how old it was. It's Mount Royal University now, if people don't know. And in their community mental health nursing course. And so my students were placed at different mental health agencies in the city. And I loved it. It was just the best experience. But it just didn't jive with my schedule working at the hospital at that time. So I couldn't do it again, at that time, though it was always in the back of my head. So more recently, I guess the context was that I was considering moving out of frontline clinical work and had kind of really more seriously considered teaching. And I guess the thinking behind that was really working in a system where I was seeing my friends and colleagues leaving at alarming rates.
Hmm.
And it was the first time in my career that I'd ever seen nurses leave not just their area of practice or their specialty area or their unit, but leave the profession entirely, mostly due to burnout and things like that. And truth be told, I was feeling some of that as well. I was considering even leaving too. So the image I keep getting in my mind is like a bucket just with this massive hole in it, just flooding out, and thinking of all the people that are leaving healthcare, right? And I thought, like, feeling very helpless, honestly, and thinking, is there some place that I could support nurses or nurses to be, like, in some way? And so that started to solidify my thought about moving more into mentorship and teaching. Was like, let's look at supporting nurses and nurses to be who are about to go into this really challenging, complex system, and what do they need? So I'd been wanting to do mentorship for many years and just didn't have the space. But when I left my job last year in clinical work, I had room, I had some space to do it. And so I hooked up with the program at U of C, the nurse mentor program at U of C, and met a fourth year student there to connect with her. At the same time, similar time, started teaching with Athabasca University with their nursing faculty in terms of community mental health nursing there too. So it just sort of all came together in a focus on teaching and mentoring nurses and nurses to be. So
Yeah, and again, it seems like through your own experiences, it sort of led to a shift and transition in what you were doing and
yeah,
recognizing, that burnout and those struggles that yourself and other nurses are experiencing and really wanting to offer that support. And it's, I think back, I'm like the statistic that I researched for my master's degree on the number of years teachers are in the profession before they leave, and it's 3 to 5 years.
yeah,
And I left classroom teaching after 5 years. So I'm my own
Yeah.
statistic. And for my master's, I developed a curriculum on new teacher mentorship, and then later taught at the University of Calgary, mentoring teachers to be, and talking
Hmm.
about, that, a part of what we talk about is the importance of taking care of yourself, and
Yeah.
how it can be very overwhelming, and it can be hard to create boundaries, and to really,
Yeah.
if you're not caring about yourself, it's hard to be able to care for other
Yeah.
people, but it can be so easy to go down that pathway. I think nursing and teaching both often tend to attract people who,
Yes.
kind of have that interest in the caring profession and helping
Yeah.
others, and making a difference, and it can be exhausting.
It
It can be
can be.
exhausting.
I think you're right. The professions attract those that are very heart led, and so they give it their all. They really invest all of themselves in it. At least that's what I've experienced. And yeah, it can be a quicker way to burning out when you do, without some of those boundaries and things that feel really hard to implement, but are pretty important.
They're pretty
So
important.
yeah,
Yeah. Yeah.
yeah,
And I wanted to ask you a little bit more about that, because I know, as you said, in working with nurses to be, and in the nursing education that you're doing, burnout would be a topic that would come up. So, what are some of the ways and strategies that you sort of discuss these things with people in both mentorship and in your instructor roles?
yeah. It certainly does come up a lot, and I think, I mean, first of all, it sounds simple, but talking about it, right? Like providing the space for that conversation. Because what I've found is that a lot of my students, the student group I'm teaching, are actually already nurses. They're practical nurses. They're going for their bachelor's degree, but they work in nursing. They've experienced it, but they don't typically have time at work to talk about some of this. So they have a space then in our seminars and our discussions for this conversation, and I think it provides a space for validation, right? To say, like, I see you and I see what you're carrying. I know that you're not only working, but you've got a family, you're studying. Like, I see that. And so we do talk about self-care. That was in one of our first seminar discussions actually last week. But I think for me, what is also really important is grounding burnout in the larger context, the systemic context, right? So that there are some things we can do as individuals, but also acknowledging what are all the factors systemically in healthcare, in teaching even, that are contributing to this, right? And I say that because when I was a young nurse, I took burnout in myself to be a sign of failure, personal failure, that I couldn't measure up or I couldn't meet expectations. I couldn't, do everything in a day that needed to be done, and I thought it was me. So I thought if I just work harder, I can get all this done. I can do all the things. And sometimes that's not true, right? There are things going on where there are so many pressures and expectations and that it's easy to personalize it and sort of take responsibility for things that are not yours to carry. So
Mhm.
positioning it in its rightful place in a larger context, I think is really important too. Yeah.
That's great that you create both that context and that space for students to be able to have those conversations about burnout and the expectations we place on ourselves, often unrealistic.
Yes.
And in doing so, then I think people realize they're not alone. There's not something wrong with them, right?
Yeah.
It's unfortunate that that people are collectively feeling, experiencing, but there's something to know that it's not you. It's not anything you're doing wrong.
No.
And then coming up, are there opportunities to come up with some ways to kind of manage that in the context that's sort of out of your control, and then sort of addressing things that are within your control?
Yeah, very much so. We talk about that as well. And in the seminar, I sort of put it to the students for their ideas, and they had lots of ways that they sort of cope. One of the kind of cool ones that came up was dancing. Dancing is very popular. I mean, I'm not skilled in that, but for many people, they're like, this is just my way of being somewhere else, like mentally, physically. And I was like, that's cool. So we talked about having a dance party at some point in the course, but virtually, I guess. But no, in all seriousness, they had some great strategies and tools for that. And it's finding what suits you, right? And so interestingly enough, some of them were talking about limiting the number of shifts they pick up. It's easy to get caught up in more shifts and more income when we all need it now, but really that self-care piece of boundaries on how much we work and how much time we're dedicating there versus the other parts of our life. So yeah.
Yeah, it can be very easy to get caught up on that. And I love that you've got your students sharing their ideas. And I look
Yeah.
forward to hearing about your epic virtual dance party. That'd be pretty fun. That would be pretty fun. Now, many of our listeners might not have experience as a nurse or being in the world of nursing or teaching for that matter. So I'd love to better understand the work that you do. So what would a typical day of teaching or being a student in your virtual classroom or being a fly on the wall look like in terms of you had mentioned to me that you use a relational practice and trauma informed education. So what does that look like in your
Yeah,
classroom and in the work that you do with students?
for sure. So the course is really well designed, and I can take no credit for that. It's some terrific educators and nurses at Athabasca created it, but it involves a combination of real time live video conferencing as a whole group, so in the group of 16 students, or in pairs with me to do some skills work and demonstrations, building psychosocial skills in mental health nursing. There's forum discussions online that they can type responses to things and respond to their colleagues or fellow students rather. And so there's different ways of sort of interacting with one another. But I suppose, the course being on mental health, we're learning and we're reviewing ways of approaching our own patients in a way that's trauma informed, which involves, first of all, the recognition that trauma for people is quite prevalent, is very common, and then we can almost assume that someone's experienced something difficult in their life. And how we go into our meeting with that person, that patient, really makes a difference to their ability to feel safe and comfortable. So it's that curiosity versus judgment that we talked about earlier. It's, providing choices and collaborating. It's really an approach that we should be using with every patient, right? But particularly in mental health, when we're facing stigma and bias, and people may have had really difficult experiences in the system. So that's the way that we're approaching our patients. Equally, I'm approaching my students in that way, right? So I'm approaching it to prioritize the relationship I have with them. In an online course, it's very challenging sometimes to build connection and a sense of community, but I use the phone. Like, no one talks on the phone anymore, but I will call my students, and some of them, when I first call, they're like, am I in trouble? I'm like, no, I'm just saying hi, how's it going, right? But connecting, making that personal connection, and then really valuing what they bring to the course, right? So my recognition with them also is that they may have experienced some of these difficulties that we actually talk about in the course. So we talk about things like suicide and domestic violence, and maybe that's been their experience personally or professionally. So really approaching the content of the course, very aware that this could be sensitive for some of them, and it might bring up some things that's pretty powerful for them. So navigating it with empathy and compassion for their situations, again, creating a safe space for them to share what they're comfortable with. And yeah, just really acknowledging that everyone's going to come from a different place. This content's going to mean different things to different people, and being really attuned to that is important. So yeah, all these connections that I try and facilitate through an online course, like I said, can feel tricky at times, but it's very doable. It just takes a little bit of time to consider how to facilitate that sense of community as a group when it's online. So
Yeah,
yeah,
versus face to face.
yeah,
Yeah,
face
it
to face,
sounds
yeah,
like you've got some great strategies that you're implementing and finding
yeah,
ways to connect and really create that sense of community, which makes such a huge difference in teaching and learning. And I guess maybe sort of speaking in general terms, do you have an example of sort of the positive impact that your teaching or your approach to teaching had with one of your students or a group of students that you worked with?
Yeah, I mean, there's a couple of students who reached out to me and said that the course was really, they really appreciated the security of it, the safety that was created. There was one student in particular who actually sent me a message and said, like, because you've created a space that's safe, I want to tell you something's been going on in my family life that's impacting my ability to really be present in the course and really give my best. And she said, because you've prioritized our mental health as students, I feel that I can tell you this. So, and I don't ask them to share any details unless they want to, but she just briefly described sort of what was going on and how it was going on in the background, and that she was still in the course, still making, the assignments and things. And we talked about what she needed to be successful. But I appreciated that, right? It was like a two-way street of communication, that she felt comfortable enough, and then I could also respond. So I think, I don't know if that's true for all the students, but certainly for her, she felt that it was okay to approach me with this and be honest, right? So yeah.
Yeah, and I think, well, it's so fantastic that she was able to reach out to you and share that with you and provide that context, that greater,
Yeah.
wider context of where she was at and what she was
Mm,
experiencing. Because I think in any sort of learning environment, there's an element of vulnerability, and you're,
yes.
in one way or another, you're being evaluated or
Yeah,
assessed.
that's right.
You're needing to pass the class or the
Yeah.
course, and it might be a class that you're choosing to take, or it's a required component of your program.
Mm.
I don't know if either of my older two would be taking math if they didn't have to, for example. But when an instructor creates that safe space where you can feel comfortable, taking a risk, getting the answer wrong, making a
Yeah.
mistake, not understanding something, and that's okay, or asking
Yeah.
a question and feeling like you don't have to worry about the type of reaction you get when you ask
Mm.
the questions that you have. I think
Mhm.
it makes it so much easier to learn, because that's where
Yeah.
the learning happens. The learning happens
Yeah.
when you're making mistakes, when you're figuring things out. And
Totally.
so creating that safe space is key. And it sounds like you've done it beautifully in what can be a tricky space to do it online. It definitely feels more challenging in the teaching I've done in an
Yes.
online environment versus in person. It's harder to get a read on people.
Totally. Yeah. And I like, that's my bag, is like psychiatry, mental health. You
Yeah.
like read people, you get an
Yeah.
intuition, but it is much harder for sure. Yeah.
Yeah. And especially if mics are off and you try and say something funny and you're just met
It's
with
just no one's
silence.
laughing. Yeah.
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 Oh, it sounds like you're doing a great job and working so well with your students. And I wanted to talk about something else as well. On social media, you recently shared your experience with meeting an incredible woman named Misha. Is that correct? Misha
Yeah.
Dreamwalker. And
Yeah.
when I read your post about it, you talked about how it really highlighted for you the importance of community, which you create
Mm.
with your students and in your teaching,
Hmm.
and connection. And I was wondering if you would share what led to the opportunity to connect with Misha and why that experience was so important to you.
Sure. So I mentioned at the beginning of the podcast that I spent a lot of time in the hospital as a young person, and that is due to a congenital condition with which I was born, called, wait for it, arthrogryposis multiplex congenita, or AMC for short. So AMC is actually an umbrella term for a whole host of conditions. Like, there's many, many, but essentially they tend to affect range of motion, joint mobility, often in the extremities. But depending on the type that you have, you can be quite differently affected than someone else with a different type. Some types are genetic and some are not. Some are more spontaneous cases. And so I haven't been very connected to that community for a number of reasons, but I had been following Misha Walker, who goes by Misha Dream Walker, on Facebook or social media for a little bit of time. And she's actually the international ambassador for AMC. And every year in the summer, she and her husband, Michael, travel one part of the world, meeting with families who have AMC and sort of building that community. So this summer, she and Michael were traveling through Canada. And so I was kind of keeping an eye on this, but not closely. Well, she made a post sometime in June of her meeting with this young person in a neighboring province. And I did a double take at these photos and video, double take, triple take. This young person that she was meeting looked like me, moved like me, like I I actually thought it was me. When I showed my husband, he said, "Oh, when did your mom send you those photos of you when you were little?" I said, "That's not me." And so, quite impulsively, I sent a message to Misha on Messenger or something, never having talked to her, and said, "I want to thank you for what you're doing because I have never in my life seen somebody that looks like me. Not ever." And she actually wrote back quite quickly and said, "Wow, like I'm actually at their house, this person's house with the family. Can I connect you to? Like connect your families?" And she said, "Where do you live?" And I said, "Calgary." And she's like, "We're coming through in a few weeks. Like, we definitely need to meet." And I was kind of like, "Oh, okay, yeah." Nervous, scared, but we did. So she came through Calgary a few weeks later. I had dinner with Misha and Michael, and it was just such a different experience for me, like such a different space. So Misha and I, although we both have AMC, we're quite differently affected. So we don't look tremendously alike, but nonetheless, there was this sort of mutual understanding, right?
Yeah.
Like you just get each other. And I never had that, right? So, my life has been filled to the brim with people who just are the most loving and kind, and also none of them have a disability. At least not in the way I do, right? So I just had never seen anybody that looked like me. And so it was very moving. My mom said it was kind of like finding the missing piece, right? Like just something that I hadn't had despite an incredible life that I've lived. So yeah, it was just a very therapeutic kind of beautiful experience. And so it was an evening with them and that's it. But meeting Misha means you also get to meet the whole community and get connected to all of the people that she brings from around the world, right? And so you talk about community and connection on your podcast almost every time, right? And I just really experienced that fully when I met her. I just really understood the importance of that. Because I've been part of lots of communities in my life, but there was always something different still about me, right? So this was a different space to be in. Yeah.
Well, and I'll say full disclosure, I've known Karen. I've known you your whole life.
You have.
Yeah. And your mom and dad are not my godparents, but my special friends, because I think our parents went through like a hippie phase.
Yes. Yes, they did. We have the photo proof.
We have the photo proof. And, I just think you're an amazing human being. And I just was so touched when you shared that story and like just your vulnerability and openness to, I think I first was filled with such joy for you, like to have made that connection and to connected with that community and for just taking that initiative and reaching out to Misha and just all the amazingness that came from that. And I think there's so much to be said for community, and then as well for, I always think, in sharing our vulnerabilities and in speaking from the heart, like the difference it makes for others, like the awareness piece.
Yeah.
creating conversation.
Yeah.
And again, helping people to feel not alone, right?
Yeah.
So, yeah, I thank you for sharing your story about that. I really appreciate it. And it was just amazing to have you share that and to learn more about you and your story, even though we've known each other for our whole lives. Our whole lives. So thank
Yeah.
you.
It's my pleasure, Tiana, and thank you very much for the opportunity to talk about it. I was really nervous about sort of going there, right, with my post initially and doing it because it would mean that I'd have to really fully step into that part of myself, right? And, I've lived a life not really feeling like I have a disability because I've done so many things. It's just not really been too much a thing. And also it has been, right? So it's recognizing the parts that, yeah, I do have a disability. And, I haven't existed in many spaces where that's true for others, but maybe this post will reach somebody that it would impact, right? Or maybe it's a young person who sees it. And I didn't have that. We didn't really have the social media channels we do now. And there's just more information out there, but maybe it'll make a difference for someone else. And it has actually opened up a world for me that I'm less reticent to step into because it is part of me, right? And okay. So, yeah, thank you. And your family has been one of the families that's been just an absolutely incredible influence in my life since I was born. So, thank you all very much too.
Well, we're super appreciative to you and your family. And in so many ways, your family has been essentially our family because
Yeah.
we didn't have any family here. And
Yeah.
I
Yeah.
always loved the times that we spent together. I won't get into all the details, but there's a number of funny stories I could bring up about our
Yeah.
childhood, but just so many wonderful memories. And yeah, we're just so grateful for our connection to you and your
I
family.
agree. Likewise. Yeah.
So, I wanted to get back a little bit to the nursing piece.
Mm-hmm.
And one of the things that I asked you about was frequently asked questions. And I think no matter what profession we're in or what we do, we kind of have those questions that people tend to ask us all the time on repeat.
Mm.
And I was wondering if I could ask you those and then have you share your
Of
responses for
course.
our listeners.
Yeah.
So, Karen, how do you do this kind of work? Isn't it just way too hard?
Yes, sometimes it is. Sometimes it feels too hard. I think it goes back to what we were talking about earlier a little bit with the way that you take care of yourselves and the way you focus on what you can and can't control. Like this work that I've done in mental health nursing has been so meaningful to me. Like it's been a privilege to meet all the patients I have that I think that's always outweighed everything else. But sometimes it does feel very heavy because you're holding a lot of people's stories, or at least I do. So, yeah, sometimes it's a lot, but I always felt like I was doing something, right? In a space that there's a lot of inequity and struggle. There's a lot of resilience and these folks, and it's nice to be part of it and make a difference, make a positive influence too, right?
Okay, next question. Why did you choose mental health nursing instead of sticking with a more traditional route?
Hmm. Yes, people are often baffled by that one for sure. Well, I actually always wanted to do pediatric nursing, kind of like my story at the very beginning about going into nursing. I was going to be a pediatric nurse and work at the children's hospital. And then I did my pediatric rotation in school, and I liked it, but I didn't love it in the way that I thought. And I was like, oh no, like now what do I do? Oh dear. But I continued on in the program, and then I did a rotation in psychiatry, and I thought, whoa, like this is really cool. This is so fascinating. Not only is the human mind just amazing, but I get to just have conversations with people and talk about their lives and their stories. Like, wow, this is cool. So I was really actually drawn to that in my program. And I also learned about myself that I'm like not the best hands-on skills nurse, bedside nurse that I kind of want to be in my brain, but like I'm more interested in what is it like for someone to be going for surgery than preparing for them for surgery, if that makes sense.
Yeah.
So the IVs and all that I can do, it's just not my strength. So yeah.
Well, and that's just part of it, right? I mean, I feel you. I thought that I wanted to be an elementary school teacher, actually. And then I thought, no, I think junior high and high school is more my jam. But you kind of have to have that openness, right?
Yeah.
To what's possible when you kind of get
You
that
do.
feeling inside that, I don't think this is exactly what I want to do, and be okay to change your mind and explore those other options. Well,
Yes.
thank you for answering those questions.
Yeah, of
Now,
course.
you had mentioned a nurse that you had as a kiddo and the impact that she left on you. Do you have a favorite teacher that you've had? And I'm curious why maybe that person really stands out for you.
Oh my gosh, there's probably been so many. I've had mostly incredible teachers. How could I pick one? It's also World Teachers Day today, so
It sure is.
thank you, Tiana, and all the teachers. Yes. As an aside, okay, that was a distraction to give me time to pick one. Oh my gosh. Well, I have a mentor teacher that when I was doing graduate school was my like supervisor for the term or whatever, Sandy, and we ended up working together later on, and we still keep in touch. And she just was like no nonsense and also very empathetic and warm, but just a great leader also. And also like understood how to take care of yourself in this work, right? And was like, take care of you kind of thing. So she promoted that. But whenever I'd go into her office crying, because I'm just like very emotional person, she'd be like, what's going on? Like just always willing to talk and just talk me through it. So she's been a lovely influence. But I've had so many teachers, so it's hard to choose. Yeah, she's one of many.
That's a good problem to have, right?
Yes,
To have
yes,
so many and not be able to pick just one necessarily, but she
yeah,
sounds amazing. She sounds like
yes,
a great teacher.
yes.
Now, when you look back at your journey, what is something that you're most proud of?
Most proud of, I would say maybe the relationships that I have and have built and sustained with, family, friends, the shorter ones with patients, like those professional relationships. Because I've just been able to meet so many people, right? And what an honor to do that. So, yeah, relationships, which is what life's about, right? So, yeah.
It all comes down to that, I feel, in so many ways.
Yeah.
I have some rapid fire questions for you.
Okay.
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 What is something that you would love to learn about or something you'd love to learn to do?
I really enjoy writing, and I always have loved the written word and like poetry, and like I love reading, but I would like to like properly learn how to write. So I like to write, but I would like to learn from someone who knows what they're doing and could like give feedback and criticize. So or critique rather. So I think that would be fun, learning to actually write.
What is a place that is at the top of your travel bucket list?
Oh man. Okay, so recently I went to the Telespark Science Center here in Calgary with my family, and we watched one of the Dome movies, and it was about the Great Bear Rainforest on the Pacific Coast in Canada. Wow, this place looks absolutely spectacular. So it's one of the few remaining forests, and I think you can actually go there and visit, but I almost wouldn't want to just leave it preserved. But it would just be like there's the special bears there, and it's just amazing. I'm very called to trees and forests right now, so that would be somehow I'd get there and go there.
Sounds beautiful and not too
Yeah,
far away.
not too far. Yeah.
What is a book, podcast, movie, or TV show you've enjoyed recently?
I just finished 2 books in rapid succession. Is it okay if I say 2 of them?
Yeah,
Okay.
absolutely.
Okay. So the first one was Invisible Women: Data Bias in a World Designed for Men, which sounds really boring, but it is not. If you like data and statistics, it is so fascinating, but also very digestible and easy to kind of take in and read. It was just so interesting about almost everything in the world that we experience or use is like based on the male prototype. And so it talks about how that impacts women. It's a bit like gender binary, but it's very, very, very interesting. So that was a good one. And then Lessons in Chemistry, which I think a lot of people are reading or is very popular, is going to be a show in a few weeks. I want to read it before that. But if you don't know, it's about a fictional female chemist in the 60s and kind of explores gender norms, gender inequities through her eyes. It's really good. I really enjoyed that.
Well, I've heard of Lessons in Chemistry. Haven't read it yet, but your other recommendation sounds great. So now I've got 2 books
good
to add to my list.
Yeah.
I love it. I love it.
Yeah.
And if you could sit down and have a conversation with someone that you would love to learn from, who would it be and why?
I feel like someone recently, I think it was Dana, maybe said her ancestors and grandparents that were passed. So I like that was mine, but then I was like, oh, maybe I'll choose another one. But my grandparents for sure who have passed away that I would love to talk more with. But I was also thinking like someone else would be Florence Nightingale. Like an absolute powerhouse of a woman. She wasn't just a nurse and a pioneer in so many ways, but like a statistician and like, you know, back when people had like 3 vocations and a million degrees basically. She was just like incredible. So she'd be fascinating to chat with, I think.
That would be amazing.
Yeah.
That would be amazing. Now, obviously, through our conversation, we've been talking about how education plays such an important role in all facets of our lives and how we work and live and play and explore. And clearly, it's played a big part for you in becoming a nurse and in the work that you do as a nurse. So I'm wondering if you have any final thoughts or words of wisdom that could empower or support other people in their own teaching and learning journeys.
I think for me, what's been really helpful when I've gone to teach or mentor is knowing myself, actually, like reflecting on my own journey, my own experiences, really thinking critically about that. Because I think it makes you more, and I think you talked about this earlier, it makes you more genuine when you go to share it or when you're sharing your wisdom or your examples. Like it's actually lived and it's from your heart. So that would probably be it, is get to know yourself, get to, in mindfulness they call it befriending yourself. Get to know yourself and befriend yourself, and just it'll help give the most genuine wisdom and knowledge to others, I think. Yeah.
I love that advice. Thank you. And Karen, I want to thank you so much for your time and sharing your story and all your wisdom today. If people are curious about you, where might be a place that they could reach out and connect and find out more about you?
I don't have a very big online presence, so it might be on LinkedIn, just Karen Lane on LinkedIn. I'm on Facebook, but not really much. So probably LinkedIn, yeah.
Yeah, I'll make sure to share that information in the show notes. Thank you so very much, Karen, for this conversation. I've learned so much and enjoyed so much chatting with you today.
Thank you, Tiana. Thank you for having this space for these conversations and having so many incredible folks on your podcast. Your first podcast was very influential in my own work life decision making. So I'm really grateful for that. And I love this podcast as well. I listen to all the time. So yeah, thank you for just having this platform and this space. Like you said, just having those conversations sometimes is really so meaningful, so valuable to so many people. So thank you, Tiana.
Oh, thank you so much, Karen. I appreciate that.